Greetings and welcome back to your destination. You've reached the Psychological Wellness Hub. We aim to help you build your knowledge and wellness about better understanding mental health and psychological concepts. Welcome back to the channel. Today's topic is geared towards answering this question. What is psychotherapy treatment? Part 3. What does it look like? Psychotherapy treatment, a quick review. Psychotherapy is a form of talk treatment that focuses primarily on mental health, substance use disorders, and other medical conditions, and many more. It's a journey of self-discovery and healing. Therapy involves you and your therapist working as a team. As a team, you work together to make connections with your problems so you can relate to those internal forces that keep the problems going. The team works together to look inside of you as well as outside of you with the intention of understanding the inner and outer workings of how the problems live and breathe. You are the navigator and the therapist is a guide to help you understand and make use of your thoughts, feelings, and actions. This is an effort to identify and, if necessary, make changes for the positive and to promoting healing. Psychotherapy treatment. Who can provide this treatment for you? Generally, any behavioral health or mental health provider who has a couple of key items that grant them the ability to provide this treatment. They will generally have a master's degree or a doctoral degree or a medical degree that focuses on some kind of behavioral science. Second, they will have had advanced training as part of their degree that involves treatment training with live patients, clients, or consumers, which is supervised by someone with the full ability to provide said treatment. Third, they will have passed an advanced exam that is chartered by a body or organization that regulates their respective profession. Finally, they have to obtain a license to practice. This usually is by a state or district that they practice in. What types of providers should I be looking for who provide psychotherapy treatment? As of this date, or 2025, the majority of these mentioned are applicable to the United States and several other countries such as Canada, the UK, Ireland, Australia, New Zealand, and more. This is based on some research and guidance from colleagues I have abroad. So, providers like psychiatrists, clinical social workers, licensed psychologists, mental health counselors, marriage and family therapists, psychiatric nurse practitioners, feel free to check out the channel and watch more videos on this topic and how you can make the best use of psychotherapy. Please also watch videos 1 and 2 about psychotherapy in general that expand more on the above topics we just described. What does psychotherapy treatment look like? Today we're going to talk about an example of that, a brief example to look at what it might involve. This is not a real patient, however the example replicates real life experiences. Marcy is a woman in her 60s who struggles with anxiety and depression. Marcy comes to psychotherapy treatment to help her deal with these conditions, but also wants to be more outgoing and notices others take advantage of her. She meets her psychotherapist for the first time. She and her psychotherapist do an assessment in her first visit to establish a diagnosis or a working diagnosis that relates to her concerns. In addition, her therapist will be establishing possible patterns and working up ideas of approaches to working with Marcy. If time allows in the first or perhaps the second session, Marcy and her therapist will develop a brief treatment plan. A treatment plan basically encompasses a goal that Marcy has that they will target the psychotherapy treatment around. This could possibly be one or several things. For example, depression, anxiety, feeling victimized by others. The treatment plan also helps them decide together what approach will be best suited to address Marcy's issues. Marcy decides that she would like to work on feelings about being victimized and how she would like to work through these. All humans have blind spots. Marcy chooses an insight-oriented or psychodynamic approach or psychodynamic psychotherapy approach to her therapy. This approach allows her and her therapist to look at information that was not in Marcy's awareness, functioning and awareness that is outside her blind spots, which one can refer to as insight. Marcy and her therapist begin by discussing and understanding more about her experiences with being victimized or walked on by others. Through several sessions, Marcy becomes more aware of the nature of being a decent and nice person and how her focus on this desire often causes her to ignore red flags and maltreatment by others. She does this till it reaches maximum exploitation, though that's not her intentions. Said differently, it's not till Marcy has been lied to, scammed, or let others and take over and over again that she starts to experience the real consequences. As she continued with her sessions, she became increasingly aware of the consequences, like the funds in her bank running low from loaning too much money, or overdraft fees, or people pulling out money because she lent out her bank card. Consequences like people taking and continuing to take. As Marcy feels bad if she were to say something because these people she helps are down on their luck. As Marcy starts to face and learn from her behavior, she begins to learn that she sometimes helps individuals whom are appreciative and return the favor. However, she also helps out predatory individuals whom only seek to exploit her. Marcy starts to learn that she is being blinded by her goodwill, as she labeled it. As she continued with more sessions, Marcy started to explore this a bit further. she learned about something called boundaries. We will talk more about this in another video. She had learned that she doesn't provide goodwill unto herself by taking a position of helping herself. She gives out to others but doesn't fill up her own gas tank, leaving herself constantly running on fumes. Marcy also learned about some repressed guilt from her childhood when she was forced to take on an adult role of caring for her siblings when she was not an adult herself. She was compensating for an adult parent who struggled with alcoholism. This was information that became available once her and her therapist looked deeper and outside Marcy's blind spots. Through further sessions, Marcy learned more about how the defenses in her self-protection system. She learned how denial and rationalization allowed her to justify giving predatory individuals more and more. She learned that when she started to feel anger at those individuals, she would engage in self-attack by mentally beating herself up and making herself feel shameful for exercising her personal rights and feelings. As Marcy became more and more aware of the defenses and improving her boundaries, she started to learn about the relationships between these and the connections to her years growing up, being parentified, or taking care of her mother and siblings. The guilt and shame associated with this, and in particular the constant put-downs offered by her parent with alcoholism, led to a fixed pattern, one that continued in adulthood. The narrative, the tapes, or the defenses called introjection continued to be present in Marcy as an adult. And in a way, her goodwill blinded her as she learned to describe it. Basically what we're saying here is that Marcy kept telling herself that she was not good enough. And every time she got angry, she would feel shame. Marcy had now discovered the engine that was driving her anxiety and depression. As she would offer care to someone else, her resources and her psychological gas ran out, and she would begin to experience feelings like anger towards that person she was helping. Much like she did when she was dressing the hungover parent who would become angry at her, Marcy would shut down to survive. Marcy in adult life would experience her anger in response to her goodwill at the person she was giving, but would constantly, like she did with her parent, shut down the anger towards the person whom she was helping that was exploiting her and turn her anger onto herself, beating herself up psychologically through this self-attack, while additionally shaming herself for having the emotion towards someone else, leaving her depressed and anxious. She would start to help the same person again, or someone else, starting to feel good again and useful until she reached that end of the rope again, where she started to feel the emotions come up, particularly the anger, and then rinse and repeat. As she continued treatment through further sessions, Marcy became more and more gradually aware of this pattern with her therapist's assistance. She engaged in her efforts to combat the self-protection system that was derailed and got back on tracks once she started to feel better. She looked further beyond the blind spots. She tapped into hope, resilience, and her healthy anxiety instead of accepting destructive anxiety. See psychological wellness videos for more on this. Marcy started to look at and facing her feelings instead of avoiding them and attacking herself for having them. Marcy started asserting herself more and more by having healthy boundaries and relating to herself and others. As she continued on in her therapy, her anxiety and depression became more and more manageable, where she was more in charge as she continued through these stages of recovery. Marcy continued to feel freer, less weighed down, more relaxed, and at ease with herself. She continued to help others, but in moderation. She was able to have a keener eye for not beating herself up and to see the red flags for others' behaviors that didn't serve her or her best interest. Marcy's self-esteem continued to grow, and she had more fulfilling and meaningful relationships with herself and others. To see another example, learn more about psychotherapy, continue to watch videos in this series, as well as videos about different types of treatment on the channel. Also keep an eye out for psychological wellness skills mentioned above in this example. Look for the playlist in the channel to learn more about growing your psychological wellness. We hope you found today's topic was useful for yourself or someone else. Let us know if it was by commenting below. Let us know what you'd like to hear about or what topics could be useful to you by commenting below, and we'll take it under consideration. If you like what you heard today and would like to hear more from Destination Psychological Wellness Hub, please consider liking and subscribing to the channel. You can do this by hitting the subscribe button at the bottom of the screen and hitting the thumbs up button. This will help you get the newest content produced by the channel to you. Please tell all your friends and family about this channel and share this and other videos with them on the channel. Encourage them too to like and subscribe. And as always, we hope your psychological wellness continues to grow with us in this community. Thank you.